Hello, it's Sarah. Just wanted to give you an update because I am currently 2 weeks post surgery to remove my thymoma. Um, so the last 2 weeks, went in for surgery like I say 2 weeks ago. Came out. Don't remember much of that very first day because I was in high dependency, and like literally don't remember anything. Apart from the fact that they put like these stockings on my legs that made my legs, they inflated my legs to keep any blood clots from forming. Had a sponge bath as well, I remember that. So yeah, that was the last 2 weeks gone. Thursday, Friday, Saturday, Sunday I was in hospital, slowly building up. I was on a lot of pain meds. I was on oxy something or other and all these different ones. But obviously I needed them. And then that Sunday, they wanted to let me go on the Saturday, but I wanted a bit longer. So Sunday, I came out. The pain was just like a dull ache. It's the initial after surgery because of all the pain meds that we're on. If anyone's been through childbirth, I would say childbirth hurts more. I've done childbirth on gas and air, and childbirth hurts more, so it was bearable. But obviously I was on a lot of pain meds. So what I had to do then was I had to move in with my mum and dad for a week, obviously with a newborn. I can't lift him at the minute. Not allowed to lift him because obviously they cracked the sternum. So yeah, so that first week there, again, kept myself topped up with pain meds and it was bearable, because this was my main fear going into this. Nobody put online saying what it felt like, and I couldn't find anything, and it's bearable. I was on the oxy, diacodine, and like paracetamol and ibuprofen, and the hospital, they were giving me it all at once every 6 hours, and as you got towards the end of the 6 hours, I was really struggling, so we kind of worked it a little bit. So had it staggered, obviously paracetamol and codeine together, and then ibuprofen a bit later, and it just took the edge off enough. Straight after surgery, you feel like your lungs are full of phlegm, full of gunk, because obviously you've had the stuff down there, the pipes and everything, and you just need to cough, and it's the horriblest. That's the worst part, is that you need to cough, and you don't feel like you can cough. So, but you do need to get up any phlegm to stop yourself from getting a chest infection, because that'd be worse in the long run, obviously, because later on when you need to cough, that's going to hurt. So listen to the instructions, hold the towel over the chest, hold the pillow over the chest, just get it up, get it out of the way, especially when you're on the strongest stuff as well. So yeah, that first week at home, staggered the pain relief, and it just plodded along, got myself back into a routine at home. Couldn't get, you have to get yourself into a different mindset, which is really hard, and the mindset is that people have got to help you. So the things that you think you used to be able to do, you just can't do anymore. So like pulling your pants up after a wee, stuff like that. That was one of the hardest things. So like my husband has become like my carer, which was hard for that first week. Second week, I've been at home. Obviously, like I say, I've got a newborn, so people have been coming each day to help me, but we've been able to kind of split it between a few people. And I've found myself being able to do a little bit more this week. So I've been able to shower myself, which is great. Obviously, you're not meant to lift both arms above your head. One arm can be risen somewhat above your head, so I'm able to like reach up and wash my hair, which is so nice. What else? Today's really the first day I've been out and about proper, but that was terrifying. The anxiety of just walking around, and I'm constantly anxious of banging into something or somebody banging into me. So getting out the front door is one of the hardest things you can do. And hopefully over this next week, like it's took it out of me today completely, going out. So I'm in bed. I'm going to rest for the rest of the day. Yeah, just trying to keep going. It's a bit of a dull ache today. I'm off the hard stuff, pain relief wise. I tried a couple of days of paracetamol, but that's not just not doing it enough. It's like a dull ache in the middle of my chest. So I'm on cocodamol. See how that goes. Maybe for a couple of days. If it's still really hurting, then I'll give the doctor a ring and see if I can get something stronger. But I just want to feel progression. I'm a control freak and I want to feel progression in what I'm doing. Emotionally, I'm tired. I have my down days, I have my up days. I'm snappy. I know I'm being snappy. I don't mean to, but it's so frustrating that you can't do things. Just need to know that I'm making progress. I mean, 2 weeks ago I was in hospital, having my chest cut open, and now I'm here, and I've been out and about, which is bonkers, yeah? So I've got to take each day. Incision is looking good. I had my chest drain stitches out on Tuesday of this week, so 2 days ago. They've healed really nicely. It's so weird that obviously they went into my, they were open to that level of being inside my chest, but I'm less conscious and scared of those than I am of my incision. I think it's just because of the broken bone. So I had my biopsy done here, which I've shown before, and I didn't worry about that. Literally, I had that on like the Thursday, and then by the Sunday I was picking my son up and doing all the feeds and everything. I wasn't worried at all about that opening, but this, I'm really anxious about it. But it's looking absolutely fantastic. He's done such a good job, the surgeon. So this is 2 weeks, as you can see. Yeah, we've got some scabs formed. So they've sutured underneath, and then there's a glue on top. It has not split, but it has the glues coming off in some places, so it's scabbed. And I did notice this when I was in the hospital, and they said not to worry. So especially finding it more where like more active places is where the glues tend to have come off. So like up here, obviously you move this gets a lot of movement. This swelled up initially for those first 2 weeks. It was like that. It was absolutely humongous come out, and it felt really hard. But they said that would happen. It's gone down a lot now. But yeah, you can see it's scabbed there, and then it's looking really, really good down to there. I had a bit of a scare today because there, the scab came off. It started bleeding. Like, I think I must have caught it on the Moses basket. It came off. It started bleeding. And oh my god, I was having a panic because I was like, oh my god, am I opening up? And then let me just show you the chest drains. So there's the 3 chest drain holes, which are still very bruised. But again, looking really good. I feel like my ribs are aching. I just feel really achy. That's the only way I can describe it. Like imagine coming down with the flu. What that feels like, that's how I'm feeling, really achy all over. But obviously I'm doing more and more each day, trying more things, so I'm going to feel more achy. Also, for the first, I was in hospital, and pretty much most of the week while I was at my mum's, I slept sitting up completely. Like, I had about 6 pillows under me. I'm down to 3 pillows, so I'm pretty much lying down, although I do feel like I need these pillows just under my arms when I sleep, because I'm sleeping on my back. I tend to tilt either way, just to give my hips a bit of rest, but I do feel like I need these pillows under my arms just for my safety, really. I don't know, it feels like it separates. And I've been very careful. I'm knowing my limits, and they really stop if you feel a twinge, which sounds gross, but you can feel like if you feel pressure putting on you, on your bone, you can feel it, and so that's the time to stop. So at this stage, think it says like cartilage has been dumped in there, so it's getting stronger and stronger. But indefinitely, like I can lift with 2 hands. I can lift a kettle, well, a kettle that's like that full, like that, nothing. Doors are hard to open. I definitely can't pull a door. So yeah, it's doing well. Not heard from the hospital yet to find out when I'm going in for my checkup, but I'm sure it'll be heard shortly and we'll find out. Check that the whole thing of the Thymoma was benign. So I just keep going. I'm just tired, and it's feels like you can't really catch your breath. My ribs are hurting today a lot. So yeah, keep you updated as we come and go, but hopefully these next few weeks will go quickly so I can pick my son up, because we've managed to work it out a way that I can feed him, which is great, and that I can cuddle him, which is great in some way. Like I can sort of cuddle him. I use a pillow a lot. I miss the whole feeling of having him on my chest and cuddling properly. So yeah, this was an update, and if anyone's got any questions about anything to do with surgery or what it feels like after, please ask away, because I couldn't find anything online. Okay, bye.